Good afternoon. My name is Juliet Glass, and tonight's presentation will be on the use of long-acting injectables for the treatment of schizophrenia. My PICO question is, in adults diagnosed with schizophrenia who are at risk for noncompliance, does the treatment with a long-acting injectable versus an oral antipsychotic reduce the rate of readmission and relapse? The goal of my report was to determine whether long-acting injectable are more effective in treating schizophrenia than oral antipsychotics. Schizophrenia is a chronic brain disorder for which there is no cure. It typically first appears in males around the age of 18 to 25 and females aged 25 to 35. The symptoms are divided into positive, negative, and cognitive symptoms and must persist for over 6 months. Positive symptoms include hallucinations and delusions. Negative symptoms include difficulty expressing emotions and planning, lack of motivation, isolation, and disinterest in day-to-day life. Cognitive symptoms include difficulty with attention and applying information to make decisions. Left untreated, these symptoms make it difficult for patients to have a normal, productive life. It affects their ability to work, to attend school, and affect their ability to have relationships. According to the Schizophrenia and Psychosis Action Alliance report, there are 2.65 million US citizens who've been diagnosed with this disorder. It is one of the top 15 leading causes of disability worldwide. It reduces patients' lifespan by an average of 28.5 years due to comorbid chronic medical conditions, high rates of substance abuse, and this population has a higher suicide rate when compared to the general population. In 2020, $281.6 billion US was spent to treat schizophrenia. This included healthcare costs, loss of productivity, social service needs, and criminal justice costs. Repeated psychotic episodes in patients with schizophrenia can lead to worsened psychopathology and decline in their social functioning. This results in significant illness, reduced life expectancy, and increased societal burdens. Thus, it is important to prevent relapses and rehospitalization among patients with schizophrenia. The clinical antipsychotic trials of intervention effectiveness, the CATIE trials, showed that 74% of patients taking an oral antipsychotic will discontinue the medication within 18 months of use. The American Psychiatric Association practice guidelines for the treatment of schizophrenia includes pharmacotherapy recommendations and psychosocial recommendations. For pharmacotherapy, they recommend the use of an oral antipsychotic medication, and that may be a typical antipsychotic or an atypical antipsychotic. They recommend the use of clozapine for patients with treatment-resistant schizophrenia, those who are at a higher risk of committing suicide or those with past suicide attempts. And then they recommend the use of long-acting injectable antipsychotic if the patient prefers. Psychosocial interventions include enrollment in coordinated specialty care programs, cognitive behavioral therapy for psychosis, psychoeducation, and supported employment services. So the clinical guidelines recommend the use of LAIs just based on patient preference, but does not recommend one route over the other. As I mentioned, the CATIE trial said that 74% of patients who are taking the oral antipsychotics will stop using it within 18 months of use. This results in 50% of relapse within 1 year and 80% of relapse in 5 years. Patient adherence has been shown to be determined by their understanding of the disorder and of the medication they are using. So the issue is that 1/2 of patients have said they were not informed about the availability of long-acting injectables. This medication can be administered as often as every 2 weeks to as much as every 6 months. The prescription rate for long-acting injectables is estimated around 20% to 33%. So the high rate of relapse and non-adherence implies that long-acting injectables are being underutilized by prescribers. But why are they not prescribing this medication? Is it because they are not as effective? Are long-acting injectables as effective or more effective in the treatment of schizophrenia? To determine the answer to that question, I conducted a two-part literature review. The first part was to determine, are long-acting injectables effective? So using this search term, schizophrenia and depot injection, I found some systematic reviews which concluded that long-acting injectables are effective as a first-line treatment and even in the early diagnosis of schizophrenia. Long-acting injectables were effective for the maintenance phase of schizophrenia, and long-acting injectables were effective treatments for reducing the symptoms in the acute phase of schizophrenia. The second part of my literature review was to compare the efficacy of long-acting over the oral antipsychotics. I used the search term schizophrenia, depot injection, and oral antipsychotics. What I found was long-acting injectables were superior to oral antipsychotics to reduce the rate of hospitalization and extend the time of medication adherence. A study conducted over the 12 months showed that long-acting injectables reduce the number of hospitalizations, the days of hospitalization, compulsory admission, and use of the emergency room services. Another study showed that patients receiving long-acting injectables had a longer treatment persistence. I found 6 total studies that concluded long-acting injectables significantly reduced the rate of hospitalization and the rate of relapse when compared to oral antipsychotics. So in conclusion, I evaluated 10 studies for my report. 3 systematic reviews showed that long-acting injectables were effective in the acute and maintenance phase, and thus is effective in preventing relapse. 3 observational studies concluded that long-acting injectables were superior to oral antipsychotics. 3 observational and 1 randomized control trial showed that long-acting injectables reduce hospitalization days and readmission rates. Thus, this evidence shows that long-acting injectables are superior to oral antipsychotics for the treatment of schizophrenia and can result in better patient outcomes. So why are prescribers not prescribing long-acting injectables? Is it because of the cost? Is it because of the lack of education? Is it because of storage? Is it because they anticipate that patients will not keep coming in for the long-acting injectable because of the decreased interaction? There's less therapeutic alliance. What needs to happen here is the research needs to be converted into practice. Education needs to be developed for providers on the use and availability of long-acting injectables, and patients as well need education so they can make the right decision for themselves. Future studies need to evaluate the outcomes with the increased use of long-acting injectables. They need to study, are providers using it more often? Does long-acting injectables improve adherence? And overall, how do they contribute to improve quality and quantity of life for these patients who suffer from a lifelong condition? And that is the end of my report. Thank you.